So let's talk about Morpheus, what it is and how it works. Morpheus is radio frequency microneedling, which is basically microneedling that's on steroids. And it leads to neocollagenesis, which is the formation of new collagen. So as we age, our dermis in our skin gets thinner and thinner and thinner and thinner, and then we end up with our crepey skin with increased laxity and wrinkles and lines. And what Morpheus does is it's controlled wounding. So it's a mechanical wound as the needles go in, and then it's a thermal injury at the tips of each of the pins where it does ablation of the skin, healthy skin in between, so it's fractional. And what that does is the body then says, oh my goodness, I've been injured. It brings in the fibroblast, and that's the cell that makes the collagen and the elastin, the ground substance. You think of collagen as like the scaffolding that helps hold the skin up, and the elastin that weaves in around it and gives the skin its elasticity. As we age, we have fewer and fewer fibroblasts, and the ones we do have are semi-retired. So they're just not doing the job they used to do. So that is why Morpheus is so incredible, is because it's actually getting your own skin to rejuvenate itself and to become plumper again, which leads to the fine lines and wrinkles softening and becoming less obvious. I get asked often, how long does Morpheus last? What we've done is permanent, however you do continue to age from that point forward. So what I like about Morpheus is it's not just targeting one particular area within the face. I can treat the entire face. So one area is typically from the hairline down to the cheek, or a secondary is from basically the chin. Sorry, one area is from the hairline to the chin, and the other is from the chin down to the collarbones. And it actually does the whole area, so it rejuvenates the entire face. If you're looking at something like PDO threads, where you're just getting sort of basically spotty. If you're looking at PDO threads, you're basically doing spot treatment. So you're getting the collagen just coming up around the cheeks, or just along the cheeks or in the nasolabial folds, whereas the Morpheus is doing all of it. So downtime for Morpheus is typically 3 to 5 days. It depends on how aggressive I have been as to how long the downtime is. And what that usually entails is some bruising. You're always going to bruise around the eyes, and you may bruise a little bit along the jawline. And then you're a little bit red, feels a bit like a sunburn. And that usually goes away within sort of 3 to 5 days. So I often get asked how many treatments will I need of Morpheus, and we usually start off with a series of 3 treatments, usually between 4 to 6 weeks apart, and at that point we can reassess. And as I said previously, what we've done is permanent, but you do continue to age, so it depends upon how old you are as to how often you will have a touch-up, and typically a touch-up's every sort of 6 to 12 months, and you'll just do a single treatment. So here we are today doing a live Morpheus. This is our Morpheus head, and what is unique about the Morpheus with the radio frequency is it is a bipolar head. So the pins are actually the positive pole that you can see coming out, and then this whole crisscross and edging here, that is the negative pole. So it's going back and forth between them, and the energy is staying directly where I'm doing the treatment. A lot of the other radio frequency devices out there are not bipolar, they're monopolar, and they'll have a grounding pad somewhere else. So the energy is not concentrating where you're doing the treatment, it's trying to find its negative pad. So that's one of the things that really sets the Morpheus apart from any of the other radio frequency and microneedling devices out there. It also is able to do, that's 8 millimeters. We're not going that deep. This one does 4 millimeters, 3 millimeters, 2 millimeters, and 1 millimeter. And what that means, it allows me to treat different depths of the skin with the single head. Different areas of the skin have different thicknesses to them, and so I can actually adjust it depending upon where I am. If I'm going around the eyes, I'll do a 1 millimeter, forehead 1 millimeter, cheeks I'm tending to do more like a 3 millimeter, and I'll do a single pass at 1 depth, and then I'll do my next pass at another depth, and my final pass at the most superficial depth, which in this case would be 1 millimeters. Craig has had his topical anesthetic on for about an hour and a half, 2 hours. Pain-wise for this, my topical is medical grade. It is amazing. I'll usually accept a pain or discomfort level as a 5 out of 10. Craig's also happily sucking on his Pronox, which is laughing gas. And a lot of people enjoy this. It actually has an analgesic quality, as well as making you kind of floaty. So you're aware of what I'm doing, you just don't care. Big plus. So here we are, we're about to start. I've set him up at 3 millimeters. I've got him in a fixed mode, which allows me to give more than one pulse of energy, which gives me a bigger ablation sphere, which translates to a stronger treatment. And I'm Dr. Nicolle Kent. I've just completed a Morpheus procedure. If you have any further questions or would like to come in for a consultation, give us a call at Tranquil Med Spa.